I have many friends and family members, people in the community ask me how to choose an appropriate speech therapist. So in that, I would like to say to our families with autism, it is a very important decision that you make. I have found that working with a behavior analyst and an occupational therapist has made me a much better speech-language pathologist. I get to get a greater feeling of what the whole child with autism looks like instead of just the child who needs speech and language therapy. So as parents are out and looking for what would best serve their child, I would highly recommend to find a speech-language pathologist that actually serves children with autism, that is one of their specialties. There are many skills that when you're working with neurotypical children, you don't address because it's, you can kind of direct them. So for example, attention. With a neurotypical child, you can address that very quickly. You can get them to attend to an object. You can do some play things that they will engage with very quickly. However, with our children with autism, some of those attention pieces are very difficult. To attend to play is very, very difficult. And so some of the tricks that speech therapists use don't necessarily work with children with autism. Along with some of that attention, choosing a speech therapist that's experienced with autism, you get a speech therapist that knows what to do about behaviors and tantruming. Whereas a speech language pathologist who doesn't work with autism as much, they don't have to experience that as often. In fact, we have clients come to our clinic who say, the speech therapist said that they couldn't see them until they didn't have behaviors anymore. And for us at our clinic, we're like, oh, behaviors are an absolutely everyday thing, and we work together as a team. And so I would highly recommend for families who are looking for a speech therapist to find someone who's A, experienced with autism, and B, preferably someone who's working with an occupational therapist and a board-certified behavior analyst.